And you will have indicated from my intervention on the Prime Minister earlier that for only the second time in my 15 years in Parliament, I'm not able to support my front bench. And you will know from our shared endeavours through our experience in usual channels that it's not easy for a former Chief Whip to not support their party, but I do so for the following reasons. I very strongly supported the tiered approach, and my part of the world, which I'm here to represent, has a very low level of virus, and my constituents have been working incredibly hard, businesses and individuals, to keep the virus under control. And there's a very low level of prevalence, not just across the community, but actually particularly amongst those who are over 60, where the level of virus remains low, and over the last few weeks has been flat or falling. And certainly in conversation with my Directors of Public Health and my local NHS, no concerns have been raised about the NHS being overwhelmed. That was my starting position. I listened very carefully to what the Prime Minister set out in his press conference on Saturday. And I looked yesterday at the data that was published. But there are several flaws with that data, Madam Deputy Speaker. First of all, the modelling that's taken place about the number of deaths is old data, and we already know, and my right honourable friend, the right honourable member for Maidenhead, set this out very clearly. We already know that the most extreme of those models is wrong. It's predicted things for dates that have already passed, and it's been wrong by a factor of 4 or 5. The second thing we know is that the modelling that SAGE has undertaken doesn't take into account, and it's set out very clearly in documents published yesterday, does not take into account the introduction of the tiered system over the last couple of weeks. So therefore, all the modelling just doesn't take into account the fact that over half of the country has been placed under Tier 2 or Tier 3 restrictions. And we know from the information published just yesterday by Steve Rotherham, the Mayor of the Liverpool City region, that region, which was the first region placed in Tier 3 restrictions, has seen quite a significant reduction in virus across all of the region, all of the parts of that region. And of course, it's that data from SAGE that's been fed into the National Health Service, and all of the modelling done by the NHS about its capacity has been based on that SAGE modelling. So if that modelling is wrong, as I believe it is, then the NHS forecasts are wrong. And it was very interesting, one of the leaked slides last week, which showed the capacity of the NHS being exhausted in the next few weeks, interestingly was not used in the presentation by the Prime Minister at the press conference, and no data has been published to substantiate it. And that's because if you look at it, according to that slide, the South West Hospital capacity should have been exceeded already, and it has not, and it is nowhere near being exceeded. And I simply, therefore, don't believe the government has made the case. The one further reason for myself is that these regulations also give the power to use reasonable force to enforce them to officers of the state who are not trained to safely use that power. The Secretary of State knows I've raised this on the floor of the House and with him and with his ministers, and I had understood there was a review to be taken place to remove it. That power should only be used by police officers who are properly trained to safely use it. For those reasons, I'm unable to support the government and will be voting against the regulations later today.